Let's talk about the lap band or laparoscopic adjustable gastric band. Like the sleeve, the band is a restrictive procedure, so all we're accomplishing with this operation is reducing your portion sizes, but you still absorb all calories you consume. In terms of hunger reduction, we see this a little bit with gastric banding, but hunger is not reduced nearly as much as it is with the sleeve or gastric bypass. As I mentioned before, restrictive procedures overall have a lower risk than malabsorptive procedures such as the gastric bypass or the duodenal switch. The lap band does have the lowest short-term risk of all surgical weight loss procedure, but it also has less power than the other operations. So usually we think that gastric banding is going to be a better option for patients with a lower body mass index, usually under 45 for optimal results. It's better for younger patients, usually under the age of 50, and it's better for patients that have good exercise tolerance, as in minimal or no joint pain or arthritis, so that you can have a good exercise regimen after surgery to assist in your weight loss. Here's what a gastric band looks like. We place the band around the upper portion of the stomach here at the top, and then it's attached to a long catheter here. And underneath your skin, a small access port is buried beneath the skin so that you can feel it a little bit, but you can't see it. Then we can inject saline down into the access port, down the tubing, into the band, and there's a balloon or a cuff on the inside of the band that will then tighten down. And the tighter the band gets, the more preferentially this part of the stomach here gets full before the bottom part. So the food is going to sort of hang up here at the top, and it'll stretch the wall of the stomach up here, which induces the sensation of fullness with a smaller portion than without a gastric band. Gastric bands are done with a minimally invasive laparoscopic technique, so similar to the gastric sleeve, there'll be 5 small incisions, about a 1/2 inch to a 1/4 inch in length, for a total length of around 2 inches total. The operation itself takes around 30 minutes, and it's almost always an outpatient stay, or rarely at the most overnight. If we look at the risks of gastric banding, most of them are really related to the device. Anytime you're putting an implantable device inside a patient's body, there are potential complications that could arise. The most common complication that we worry about after a sleeve is slippage of the band, where the band slips out of position and it's not angulated properly. So if a patient has a slip, they'll usually know it because they'll have a lot of vomiting issues that weren't there before the slip happened. Erosion of the band is also a device-related complication where the band wears a hole with time through the wall of the stomach, so that part of the band actually ends up being on the inside of the stomach instead of being wrapped around the outside. Erosions typically necessitate removal of the band completely in order for the erosion to heal. Infection is a rare complication after gastric banding, but is always a potential possibility anytime a foreign object is involved. Recovery of a gastric band patient is typically pretty quick. Usually patients will take 3 to 7 days off work unless they have a heavy lifting job. And we advance your diet after gastric banding more quickly than we do for the other operations. So patients will do 24 hours of liquids, 48 hours of puree, and then they'll be on solid foods after that. Most band patients will need 4 to 6 adjustments of their band in year 1, and then 1 or 2 during year 2, and then usually yearly thereafter. And we also recommend yearly x-rays of your band where we can check the location to make sure everything looks good. Adjustment of gastric band is a simple procedure that we do just in the office, where a patient will lay down on the exam table. We feel around where the access port is. We spray some freeze spray on the skin to numb it, and then we just pop a needle in through the skin into the access port and inject some saline. Usually a gastric band adjustment takes only a few minutes once we get started. In terms of results after a gastric band, I mentioned with the other operations that we shoot for a goal of 75% loss of excess body weight. Because the band is a less powerful operation, we usually look for around 60%. So again, if a patient weighs 100 pounds over their ideal body weight, this is going to be around 60 pounds.